Hello everyone. Now we will see what is lay reporting of health information. So this is important for very short as well as Viva concerned. So we have seen that there are so many sources of health information are there like census, registration of vital events, demographic surveys, disease registers and all. There are so many sources are there, and lay reporting is also one of the source of health information. And already this many sources are there, then what is the need of this lay reporting? Because we are having so many challenges in the collection of health information. Say for example, registration of vital events. So we should register vital events like births, deaths within 20 days, but is everyone doing that? So there are gaps in the data collection, and many countries lack proper vital registration registers. And even demographic surveys also cannot achieve complete recording. That's why we need a temporary substitute. But we are not replacing other sources, but we are keeping lay reporting as a substitute to collect health information. And now we will see what is lay reporting. Lay reporting means two words are there, lay and reporting. Reporting means collection of the health information, analysis, and reporting it to higher level authorities. That is reporting. Lay means lay persons or non-professional health workers. Here, collection of the information which is health related, and use of information and transmission of information to higher health system levels by lay or non-professional health workers. Here, non-professional health workers means village health guides, multi-purpose workers, ASHA worker, Anganwadi worker, pharmacist, paramedical staff. And so these persons and even community persons also, the people who are residing in the village or community also, so they are reporting the health related information to higher authorities. So that is lay reporting. And how this lay reporting will work means, so we will give a list with checklist with some symptoms. So these paramedical staff or non-professional health workers will take those symptoms, and if the symptoms are there, they will report to higher authorities. Say for example, for tuberculosis, to tell a presumptive TB case, cough more than 2 weeks and night sweats, weight loss, like that. If a person is having all these symptoms, then they will report it to higher authorities that this person could be having tuberculosis, like that they will report to higher authorities. And this reporting is from the grassroots or this non-professional health workers. So this is lay reporting, and they will not only collect details regarding disease patterns, but they will also collect data regarding births, deaths and all. So remember, this lay reporting is also a form of source of health information. And I'm Dr. Anusha. Subscribe to Community Medicine Made Simple by me. Like, share, subscribe for further videos.